Hello, my name is Udofia. I'm Director of Community Health and Wellbeing here at West End House Boys and Girls Club. I am a social worker by trade. I help lead our trauma-informed work. And basically all that means is I help create a community of wellness. How you doing, Juliana?
I'm okay. How are you?
I'm good. So, at the heart of everything I do is the relationship building. So, the first thing that I do when I come through the doors here is I'm always checking in with our kids. And also through that, right, since there's so many kids that attend West End House Boys and Girls Club, I'm making sure that our staff have like the supports they need to support our kids. So, yeah, this is kind of like our trauma informed strategy. Like, I feel like we're doing a lot of great work here already. So, we have like the physiological needs with the food and everything that Lisa does, the safety. I think Western House obviously safety. I don't know. How does that sound? Yeah.
Yes.
And then other things that I do incorporate working with families, so getting families resources that they might need for anything that might be beyond our capacity here, getting referrals to mental health supports, any type of school supports. I meet with schools sometimes. I think sometimes it's just kind of dissecting that and having parents like understand what mental health actually is. And it's not this scary taboo thing. And just because we're bringing up these mental health concerns doesn't mean like it's code red for your kid, but rather, okay, we just have to come about this a little differently or provide these type of resources. So having those conversations with our parents, our larger community about like what is mental health. Basically trying to be as holistic for the support that our families and kids might need. The reason why I got into this work is because I truly believe in community support. What the beauty about West End House is when kids come in here, they have a community, right? They have staff that know the names, they have staff that give them shout outs, they have staff that they know that they can go to that care. People that have been here for like 10 plus years, 15 plus years, right? There's a certain level of stake that they've put in the ground in this work that I think is truly admirable. And that community heart of it, which I keep harping on, is everything to me, right? Because I do think that when we're working to support a family, a young person, a community, as a team, you can make way more of an impact than you can as a silo, as one person. We have staff here that came here when they were kids and now that they're working here, you know, so we have different generations of kids coming in and out. So I think that long lasting impact is huge for me because I want our kids not just be good in here, but outside of here, and also know that when they leave here, they can always come back. And we see tons of alumni always come back. So yeah, I think it's a beautiful thing, community work. From my experience, when I see that a kid is disengaged, I think a lot of times that comes from the lack of connection that they might be feeling with the community. A lot of times during this work, what I see is when our kids are going through a lot of things, they a lot of times feel alone, feeling like they're isolated, they can't do these things with people because people don't understand. So I think a big part of my work is just making sure that kids know that even through the toughest, most hardships times, that they have connections here. And when they have those connections, I feel like kids have the tools that they need to get through it. Because I think the first part of feeling like you can get through something is knowing that you're not alone. At the end of the day, even with all these challenges that feel so daunting and overwhelming, and sometimes it even makes me a little sadder at the end of my days, it's nice knowing that I'm coming into a community that connection is real, and I think has also helped me do a better job with leading the organization, our trauma-informed wellness work. Our kids sometimes get struggle interacting with each other, especially coming out of COVID. That's what, 2 years of learning loss of kids not really just being with each other in community. So just trying to find ways, and Wellness Wednesday is like we do teamwork type of activities. So our kids can just work with other kids and like try to come up with a goal together and things like that. I'm really big into moving our body, so we do programs that really reach our teens. So we do this program called Fresh, Fit, and Healthy, where our teens engage in working out and then also seeing how they feel after that working out, just to try and get them to see that moving your body is, in my opinion, a quick way to make you feel a little better throughout your day and give you that energy you need to accomplish things. I think one of the most important things about our work is making sure that we're having our kids identify how they're feeling, and then you can get the support that you might need. And then right now, really just trying to take the work to the next level of getting our organization even more into the trauma-informed way, which really it means more trainings with our staff, trying to locate other organizations that also believe in what we do, so we can be partners, because I believe this community has everything it's need, but now it's just trying to get like all the other resources as well to kind of amplify all the things that we're doing already. Everything that I do isn't possible without me working with the team that I work with. It's our staff that implement the check-ins. It's our staff that let me know if something needs to be flagged. So a code red, check in with this parent, check in with this kid. And I am just super appreciative and grateful for the team that I'm on, because without them, my job's not possible. At the heart of this work is love, and I think West End House has a lot of love in the work that we do. So, yeah.